Dear viewers, welcome back to the fascinating world of ancient Roman medicine. In this third part of Roman medicine, we discuss contributions of three key figures: Asclepiades, Dioscorides, and Galen. Their contributions laid the foundation stone of current medical field to certain extent. Asclepiades is known as Prince of Physician. He was born in 124 BC at Prusa in Bithynia, Asia Minor, on Black Sea shore, and finally settled in Rome. He is a pioneer physician of psychotherapy and physical therapy. He developed criteria for an ideal cure with a motto Cito tuto et jucundo, that is, swiftly, safely, and pleasantly. We can correlate this with concept of ideal cure given by Dr. Hahnemann in aphorism number 2. Asclepiades is also called as Hippocrates of chronic disease. He emphasized active measures to be taken in patient care. To him, health was balance between tension and relaxation. This theory was known as Methodism. He used music for the treatment of insane, described malarial fever accurately, and also mentioned that this fever has periodicity. He established practice of tracheostomy and treated mentally ill patients with kindness and humanity. Second key figure is Dioscorides. He is known as Father of Materia Medica. His book has titled De Materia Medica. He lived from 40 to 90 AD, served as a Greek army surgeon under Nero. He authored 5-volume encyclopedia De Materia Medica, a foundational text on herbal medicines. He studied 600 plants and their active principles. He identified and described use of mineral remedies such as lead and copper. And Claudius Galen, most important key figure in the medical history. He is a towering figure in the field of medicine, follower of Hippocrates. Born in 131 AD in Pergamum, Asia Minor, and later moved to Rome. He served as physician to 3 Roman emperors. His medical theories influenced Western medicine for over 1500 years until the Renaissance period. He was a strong-headed person known for his rigid views and rejecting the opposing ideas. He gave punishment to those who dared to question his knowledge. Michael Servetus, who discovered pulmonary circulation, was later executed, burned to death. Andrew Vesalium, father of modern anatomy, was thrown out of Padua as he disposed of many anatomical myths. William Harvey discovered systemic circulation had to bear much criticism. So this is the representation of this Michael Servetus, burned to death, Andrew Vesalius thrown out of Padua, and William Harvey had to bear a lot of criticism. Contributions of Galen are most important. He advocated the doctrine of humors: blood, flame, yellow bile and black bile. In medieval time it was changed to sanguine, phlegmatic, melancholic and choleric temperaments. He described 7 pairs of cranial nerves and distinguished between sensory and motor nerves. He gave the concept of spirit of pneuma. He said body consisted 3 pneumas or spirit, which entered via windpipe, the animal spirit, the natural spirit and the vital spirit. But he could not explain how these were related to health and diseases. He demonstrated aphonia was produced by dissection of recurrent laryngeal nerve and demonstrated position of ureter. He divided the diseases into 3 classes: simple tissue diseases, organic diseases and dyscrasias, that is malformations and abnormalities. Organic diseases affecting compound tissues, whereas simple tissue diseases affecting muscles and nerves. He further concept of disease and treatment. He believed man is made up of body and soul is more important and eternal. He described number of causes of diseases as predisposing, exciting and environmental. He also believed in single simple remedies, herbs as a treatment, and role of diet, baths and massage was also emphasized. Anatomy, he has contributed a lot in various statements which are actually myths, which were corrected by Andrew Vesalius in 16th century. So Galen said there was no marrow in bones. So number 1 to 7 are the incorrect statements of Galen, which were corrected later by Andrew Vesalius. So we call it as anatomical myths of Galen. What he said? There was no marrow in bones. During parturition, there was separation of symphysis pubis. The inferior maxilla consists of 2 pieces of bones. There is opening between the 2 ventricles. The inferior vena cava arose from the liver. Sternum is composed by 7 parts of the bone. Blood is formed in the liver from the foodstuff of chyle. His descriptions of bones and muscles were accurate. He showed that veins were connected to heart and the nerves arise from the nervous system. He described the nerve to the larynx and anatomy of spinal cord. He postulated fundamental principle of life as pneuma, which has three forms: animal spirit in the brain responsible for sensory perception, vital spirit centered in the heart regulating blood flow and temperatures, natural spirit residing in the liver and responsible for nutrition and metabolism. Galen invented ancient antidote to snakebite, theria. His treatise on prognosis from pulse was a detailed study of the pulse and its numerous variations. Thus, Galen's teachings lasted in the medical world for 1500 years. So, in this video, we have learned the contributions of Asclepiades, Dioscorides and Galen. So, do comment, like and subscribe for my videos on Roman medicine, which is a part of series on history of medicine. Do study my videos on Organon of medicine. So, how do you like these videos on history of medicine series? Please comment and like my videos. Thank you.